Okay, hi everyone, and afternoon, and welcome to this Council of Deans of Health webinar on environmental sustainability in AHP pre-registration curricula. We're really happy for everyone to join this afternoon on what is an extremely topical day to have this webinar on the closing of COP28 today. And we're also really delighted to have all our guests with us who will introduce themselves as the webinar goes on, but really thankful for them all contributing to today's webinar and talking about a really important subject. So climate change is a global emergency and a health emergency, which means the healthcare workforce and consequently the healthcare education has a part to play in it. And the council is really delighted today to support the launch of some new and important guidance. And this is the focus of today's webinar. So today, some guidance has been launched on education for sustainable healthcare with pre-registration AHP curricula. And we're going to hear in today's webinar from some of the authors and contributors to that guidance and hear about the development aims and recommendations of the guidance as well. We will also have a bit of time at the end for some Q&A from you all. So if you do have any comments, please do post them in the chat, the webinar chat. And if you do have any questions, we really welcome any questions or comments from the audience today. So please feel free to use the chat and Q&A function in Zoom. So without further ado, I'll pass on to some very important people here today who know a lot more about the topic than I do. So I'd like to pass on to Linda Hindle, who's the Deputy Chief Allied Health Professions Officer at the Office for Health Improvement and Disparities, and also Jessie Frost, who's Chief Sustainability Officer, Senior Clinical Fellow. And thank you to Linda and Jessie for the guidance. You're the key driving force behind it, and really happy to have you here today to talk about this guidance. So over to you two.
Thank you very much, Robin, and thank you to the Council of Deans for Health for publishing this and hosting the webinar today. So everyone, thanks ever so much for joining the webinar. We're really pleased to be able to launch the product and to tell you a bit more about it. But particular thanks to many of the colleagues who are on this call who have been part of the development or advice or responding to questionnaires, etc., as part of the process of developing this guidance. So I'm just going to speak for 5 minutes maximum, just to set the context a little bit, and then I'll be handing over to Jessie, who is the author of the guidance, and she's going to take us through the process of developing it and you know what it looks like, what's in it, and how we hope it can help you. So just in terms of the background to this, it probably started for us as allied health professionals back in 2020, when we did a survey amongst allied health professionals to try and understand what AHPs thought about environmental sustainability and their role in sustainable healthcare. And what we heard from allied health professionals really strongly was that protecting the environment is really important to them in their personal lives. They're doing a lot already in their personal lives, and they wanted to do more in their professional context. But it wasn't always obvious what was the best thing to do or what was the least worst thing to do in a professional context in order to protect the planet at the same time as providing quality healthcare. So they wanted some support around that. And what we also asked was, where were the areas that AHPs thought we had the most opportunity to intervene, and what would be the priorities for us? And there were 5 themes that came out of that survey. The first one of them was actually around environmental literacy and understanding kind of more about sustainable healthcare and what our role is and what the opportunities were for us. So that's part of what led to this. But the other ones were around prevention, early intervention, and the models of care, which enable us to use less carbon as part of the care that we provide. Food and nutrition, which wasn't just about the actual diet and food that people eat, but about reducing food waste and how we could affect our care in order to minimise disruption of meal times, for example. Digital and the use of technology. And then the final one was around the use of resources, medicines, equipment, etc. So as a result of all of that, we developed in 2021 the Greener AHP Hub and the Greener AHP programme, and that is supported by a Greener AHP partnership group, which includes many partners, including all of the AHP professional bodies, where we work together to try and drive this agenda forward. And allied health professionals have been recognised as kind of professional, clinical professional leaders in this space by colleagues in the Greener NHS team and by other clinical teams, which I think is really positive for us. So what we heard from AHPs and AHP learners is that they want to know more about sustainable healthcare and how that fits into their practice. And so we started conversations with professional bodies and with colleagues in academia about how we might do that. And what colleagues were saying to us is, we don't want to all start reinventing the wheel, all start writing guidance, when actually a lot of it is going to be similar. And therefore there was a request for us, and in particular from Jessie in her clinical fellowship, to produce some guidance, not dissimilar to the guidance that the Council of Deans produced around embedding public health and prevention into Pre-Reg AHP curricula, so that we've done something once that it then can be used by individual programme leaders and by professional bodies. So that is what we've done. That is what this product is that we're launching today. As I say, thank you again to everyone who's contributed it, and in particular Jessie. So in a second, I'm going to hand over to Jessie so that she can take us through that. But I think one of my pleas really would be to everyone on the call to kind of take some time to have a look at it. But probably even more importantly than that, that we would really welcome feedback on how it feels, how it to use it, because we can go back and adapt it in the future. So if there's anything you think needs amending, please do let us know, and Jessie will talk to you about how we can do that. So without further ado, I'll hand over to Jessie, who is a senior clinical fellow with the Greener NHS team and a physiotherapist. Jessie, thank you.
Thank you very much, Linda. I'm just going to attempt to share my screen, and if someone could just give me a shout once you can see my slides and slideshow.
Yeah, we can see it. Yeah.
Fabulous. Lovely. So thank you very much for that introduction, Linda. As Linda and Robin have already introduced me, I won't do that for you all again. But just to say, it's a real pleasure to be able to share this piece of Four Nations multi-agency work with you today. So in my presentation, I'm going to be providing an overview of the document that we've developed, building on what Linda's already said about why it's important to incorporate it into allied health education, before introducing you to a timeline and the stakeholders that have been involved in the work. We'll then have a little look at the kind of high-level document structure and how you might use it, before summarising with a bit of a tribute to the patient voice, and a reminder about why this topic is so important to healthcare professionals. And then lastly, as Linda mentioned, signposting you to opportunities to provide your honest feedback about the work, because we really, really value everybody's input, and we can make this better if we possibly can. So following on from kind of Linda's resounding call to action in her opening address, as we all know, the climate crisis is a health crisis. But it's also important to point out that this decision to produce this document wasn't just top down. So in fact, probably the converse is true, that whilst large multinational organisations and researchers, as you can see from a few of the examples on this slide, have been calling for the inclusion of planetary health and environmental sustainability into healthcare education, there has been equally, if not greater, pressure from students and learners who are really demanding to be taught about the climate crisis and planetary health as part of their curriculum. And I think it's fair to say that probably the momentum has started with medical schools and medical students. And I'd like to take this opportunity to highlight the very important forerunners of this work, without whom this document wouldn't have been possible. So all of their work has been heavily referenced throughout the document and listed in Appendix B, but of particular mention and kind of a blueprint to this work really is the document entitled Education for Sustainable Healthcare, a Curriculum for the UK. So that was endorsed by our colleagues in the Medical Schools Council and authored by Sanya Mayton and Teresa Martin et al. So just a shout out for them for getting us where we are now and for supporting this piece of work for AHPs. So this momentum has happily snowballed with a call to action now widespread with students across multiple healthcare disciplines, not just medics, involved in things like the Planetary Health Report Card, for example, down in the bottom left-hand corner. And I guess just before proceeding, just to reiterate that the bottom line is that sustainable healthcare is just good healthcare. It's good for our patients first and foremost, but it's also good for our staff. It's good for the health of the public and the population and for the environment on which we depend. So on to a brief look at the timeline. Linda's already introduced a little bit about kind of where the seeds were first sown. So back in kind of autumn, winter last year, we were having numerous conversations with a variety of stakeholders across the UK, so including professional bodies, academics, clinicians, students. And it soon became clear, as Linda said, that people really wanted guidance. So guidance on both what the fundamental areas of planetary health should be included in healthcare programmes, but also how it could be delivered and how it's applicable specifically to AHP education, rather than just to medical education, which is kind of the bulk of the research out there at the moment in the guidance. And I would say whilst some stakeholders viewed this as more or less important, no one disagreed with this principle. So we sought approval then from the 4 chief AHP offices across the 4 UK nations, all of whom gave it their full support, and the Council of Deans of Health kindly agreed to take on the endorsement of the publication. So we then began recruitment to form a small but kind of representative advisory group. And in March, our first advisory group took place, and together we crafted a survey that was then distributed to all AHP academics across the UK to get a baseline of what the current provision actually looked like. So any enablers or barriers to inclusion, thoughts about what they needed, and examples of any good current practice. So then between March and April, we undertook some comprehensive sort of desk-based research to explore what frameworks of guidance was currently in existence in the system and what, if anything, was missing. So this sort of research, together with the results of the academic survey, they were then analysed together with our advisory group and helped to shape the first skeleton iteration of the document. So then by June, we collaborated with colleagues at Oxford Brook University, who had responded to the academic survey, to scale and spread a student survey or a learner survey that one of their MSc learners had developed. And this was then widely disseminated to gather learner views. And feedback from the first iteration of the document was gathered and shaped in the third advisory group to form the second iteration of the document. So you can see it's been quite a significant process. And this second iteration was further progressed by the results of the student survey. So finally, the third iteration was then circulated for comment with final edits and kind of quality assurance from a smaller group of partners. And really important to note that kind of across throughout the whole timeline is that been significant contributions made by an even wider group of stakeholders. So that's kind of via small focus groups, one-to-one meetings, presentations, that kind of thing. So this is an initial glimpse at the overarching model. So you'll see in green in the centre of the graphic what we've described as 5 foundations of planetary health and sustainable healthcare. And then around the circumference are 6 principles of how to incorporate the foundations into curricula and programmes. And I'll cover this in more detail in subsequent slides, but for now it's just sort of to set the scene to then demonstrate how we've structured the document. So we made this decision to kind of chunk up the document into 3 distinct sections. Because as you can imagine, based on the scale of the problem, there's quite a lot of information to include. So we've tried to endeavour to make it as user-friendly as possible, as more kind of a dip in and dip out resource, rather than something you'd read cover to cover. So, and this is supported by the formatting with hyperlinked contents. So the first section includes the background, the policy and the mandate, and the current position, and that's kind of across where professional bodies are at, academics, learners, and higher education institutions. And this also includes kind of the headlines from both of the surveys, the academic and learner survey. Then the second section is kind of the main body of the document, the part that I draw your attention to, because this is the bit that really speaks to the model that we've designed. And to make it more palatable, we've broken it down into the what, so the 5 foundations, as you recall from the previous slide, those in green, of what should be included. and then the how. So sort of separated that then into 6 principles of how to practically apply this into curricula and courses. And where appropriate throughout, there's kind of clear signposting to the most useful resources to further information, training and references. And then lastly, section 3 includes our conclusions, an extensive reference list, and really importantly, appendices that have got further examples of good practice from professional bodies, from HEIs, but also the detailed results of the survey, some legislation and kind of mandates, and then other existing frameworks that I referred to previously that we've built this upon. So are really worth looking at the appendices as well. So we further broke down our sunflower into the what and the how. So this is just starting with the what. So this describes the 5 foundations of what to include in curriculum programs. And we made all these decisions gathered from all of the literature that we looked at, from experts on the advisory group and from the existing frameworks that were already out there. So starting at the centre of the sunflower is the concept that before anything else, learners must have a robust understanding of planetary health. So they need a foundation appreciation of the interdependence and inextricable links between nature, health and humans, because without that understanding, we're kind of missing all the other concepts. So thereafter, each of the quarters then explores an aspect of sustainable healthcare within the context of planetary health. So that includes the health impacts of environmental degradation. So how is human health impacted by environmental harms? The impact of healthcare on the environment. So what are we doing within healthcare that is resulting in further harm to the environment and thus perpetuating the health impacts of environmental breakdown in our population? A look at what sustainable clinical practice is and what it should be. And then finally, how we as AHPs have a responsibility to be both environment and health advocates. We must be able to advocate for good health without causing further harm to the environment, because again, it perpetuates ill health. So I'm just going to use one foundation area to describe how within the document we've then presented this information. So I've chosen foundation 2. So these are the health impacts of the environmental degradation on social and environmental determinants of health. So each foundation starts with a basic background. So that includes the evidence base. Then where possible, we've tried to focus on a specific kind of area applicable to AHPs before then giving examples in the context of health and care. So here's just one example from the document that we've used in Foundation 2. So this is heat waves as an effect of climate change and the subsequent impact on human health. So this is, of course, one of hundreds of possible scenarios to illustrate where AHPs might come into contact with patients or populations whose health are being impacted by the effects of climate change. So it's really just to be used as a sort of starting point for each profession to identify where they might see this patient. So for example, a patient has a fall at home as a consequence of a heat stroke. A paramedic might attend to that call out, bring that patient into hospital where they might meet a radiographer via attendance in A&E to scan their hip. They then might come into contact with an ODP in theatres where they have a surgical procedure to fix their fractured hip. Then subsequently, they might meet a speech and language therapist to assess their hydration post-operatively, a physio on the ward for rehab, an O2 prior to discharge. So just to kind of hopefully that just helps to serve as an illustration of how human health and the environmental breakdown are inextricable and how AHPs will frequently come into contact with patients suffering from the health impacts of climate change. And lastly, at the end of each foundation sections is a resources box that's got a bit more in the document. It's countdown reports and resources and any further training to support that particular foundation area for academics, learners, clinicians alike, anybody accessing the document. So the second bit of the sunflower, the how. So this sunflower describes the 6 principles of how to include this material into curriculum programs. And this was gathered again from published literature, from the other frameworks that are out there already, and also in discussion with many academics and learners, in addition to the information we received back from the academic and student surveys. So for those academics in the room, forgive me, I'm not trying to teach you how to suck eggs. You'll know the majority of this anyway, but we just felt it was important to qualify each of the different principles for completeness. So the 6 principles around this sunflower are ensuring that the material is woven throughout curricula as a golden thread, rather than as standalone or additional teaching, because we heard a lot about there's no room in the curriculum. So it's about trying to find ways to weave it in what is already in existence. Ensuring that there are both robust learning outcomes and assessment, so two of the sixths there, to test that learners have understood and can apply this learning. And of course, we recognise that the subject is a complex one, so nurturing systems and critical thinking in order to embrace complexity at pre-reg level, so that graduates enter the equally complex healthcare systems with an appreciation of the problems, which will give them a head start in identification of mitigation or adaptive solutions to these wicked problems. Interprofessional learning and collaboration across disciplines, obviously that's something that goes on in HEIs anyway, to really promote that collective thinking, which is desperately needed in this area, mirrors clinical teamwork and encourages synergy across the system. And then lastly, but very importantly, educator wellbeing is really high priority, and learner wellbeing, because there needs to be kind of focus on co-benefits of action and make sure that there are resources and signposting readily available to support eco-anxiety, because talking about this stuff can be really hard for both academics and learners. So similar to each of the foundation areas, I've used one principle as an example of how we've tried to systematically present the material in the guidance. So in this instance, around learning outcomes. So each principle starts with a basic background and evidence base. And in this principle for learning outcomes, we've then tried to reference any that we found in existing frameworks. So this table here has kind of come from all of those frameworks that I've already referenced and are in the appendix. So kind of things that can be used across other areas of healthcare, like medicine, that have more generic learning outcomes that could apply across most areas of healthcare, or could be used or be adapted for AHP curriculum programs. So then this is followed by some more specific learning outcome examples, more applicable to AHP curricula or programs where those are available, and some of these were gathered from a survey. So you can see from the top table, those learning outcomes that might be applicable across professions. For example, it's quite small text, so I don't expect you to be able to read it, but for example, demonstrating the ability to take an environmental health history within a patient consultation. You can see how that could be quite generally applicable across many areas of healthcare. And then the example in orange there is a bit more specific to AHP professions involved with rehabilitation, for example, as examples. And then lastly, section 3 of the document, you'll find not only a comprehensive reference list, but as I mentioned, some really valuable resources in the appendix. So in addition to the full survey results and the table of policy and legislation documents, as I mentioned at the beginning, we kind of consolidated a list of what we considered are some really, really important and useful frameworks already in existence. So those are in Appendix B, and so they're really worth looking at because they've really formed the foundation of this document itself. We also created a table in Appendix C that demonstrates sustainable AHP practice examples, because we heard from a lot of people that this was really useful to sort of see it in practice. So it's not an exhaustive list, but hopefully it provides some sort of tangible examples of sustainable healthcare practice that AHP professionals can recognise. And this was canvassed across AHPs. We had all 14 AHP groups looking at this and giving suggestions. And these are kind of grouped into an area of sustainable clinical practice like prevention or health promotion, lean pathways, for example. And then we've also included some examples from AHP professional standards and curricula where they were available. So any kind of Royal Colleges or professional bodies that have already started to include sustainable healthcare into their curricula. Again, of course, they're not exhaustive, nor do they cover all areas of education or practice that sustainable healthcare could be incorporated into, but they're hopefully a useful reference point for professional bodies or Royal Colleges wishing to include or increase their healthcare content in the curricula to give them a bit of an idea. So we'll be pleased to know we've nearly finished. So just before I finish and hand over to the next session with our illustrious panel, I thought it would be helpful just to use a patient's story as a way of reflecting on the importance of healthcare professionals graduating with a good baseline knowledge of planetary health and sustainable healthcare. So I'm sure many of you will recognise this beautiful little girl, Ella Roberta Kissy Deborah, who died from an asthma attack in 2003 at the age of just 8 years old. She was the first person in the UK to have air pollution cited as a cause of death on her death certificate. And there are, of course, hundreds of examples we could use of the way that climate change is affecting patient, staff and populations. So this is just one story, and it happens to just be about air pollution. So one part of the problem, of the big problem. It's just that I was able to get some useful YouTube footage for this story. So I think it just speaks to the desire from people and patients and our population to know more about health impacts of climate change, and that they expect us as healthcare professionals to be the conduit of this knowledge. So unless we ensure both providing adequate patient care. So I'm just going to play a short clip, hopefully, if it works. And I'm going to stop just halfway through. This is where the tech fails me. Works in practice, but then not on the day. That's a pain.
That'd be a shame when you've just tested it and it worked.
Well, hopefully, given that I can't get this to work. Oh. Yeah, Felix, I don't think I'm going to be able to play my own. I know, typical.
Oh, I'm sorry, Jessie. I don't know whether Felix has it on in the background.
But not what I want. Anyway, not to worry. It's not a deal breaker because it's only a minute and a half. But suffice to say that this will be included hopefully on the slides, and so we can share it. Okay. Do you want to share it, please? No.
Yeah, we'll send the.
No, sorry, I think we're going to have to skip that bit.
Okay.
Sorry. But anyway, watch the video. We'll post the slides up so you've got the link, or I'll post the link in the chat, because it's really, it's basically Ella's mum saying how important for GPs and health to be good, the impacts of
yeah, I think Jess is breaking up a little bit, so maybe
I'm really just coming to the end of the slide.
Is that you finished, Jessie? Because yeah, your line was just going a bit at the end there. So I'll take over. But massive thank you, Jessie, for that really thorough overview of what was a lot of work. So we've got now for the next 20 to 25 minutes, 20 if we can do it actually, a bit of a panel conversation with colleagues from, I suppose, across a spectrum of learners, academics, professional bodies, to get a sense of kind of, I suppose, reflections on this document, how they either have or will incorporate environmental sustainability into their work. So what I'm going to do is let each of our colleagues just very, very briefly introduce themselves, just so you know who everyone is. And then we've got a question for each, which hopefully will kind of build some of that understanding. And then I think, as Robin said earlier on, if you've got any questions, we'd really love to have those, and we should have 10 minutes at the end to answer those on the webinar, but if not, we can try and do them in the chat or afterwards. So let me ask each of my colleagues for about 30 seconds to give a bit of heads up to themselves. So Liz, I'm going to come to you first, please.
Thanks, Linda. I'm Liz Stockley, and I'm the Chief Executive of the British Dietetic Association. But I do just have to say I'm not a dietitian, so no scientific questions for me, please. Sustainability is a real passion of our members and our association, not only because we've got changes to make as an association and as a membership body, but also because of the impact of nutrition and hydration on the planet.
Lovely. Thank you for that, Liz. Jill, over to you.
Good afternoon. Thanks for having me. My name's Jill Morgan. I'm working in Cardiff University at the moment. I'm currently Director of Learning and Teaching across all of our undergraduate students in the School of Healthcare Sciences. which encompasses a number of AHP nursing and midwifery students. And I've been trying to explore this field in our curricula since about 2019. So it's great to see this pull together.
Brilliant, brilliant, and I'll look forward to hearing your experience. Simon.
Hello everyone, I'm Simon Curran. I work at Liverpool University in the School of Health Sciences. I'm one of the AHP leads for one of the programs. So I guess to give a bit of context, I have the ability to kind of influence some programs and some students who are going to be graduates.
Brilliant. Thank you, Simon. Tanya?
And I lead one of the AHP programs in the Department of Health, Sport, Health Sciences and Social Work in the Faculty of Health and Life Sciences at Oxford Brookes University. I'm a paediatric occupational therapist by background, and I'm very lucky to have been involved in various research and educational experiences related to this topic. So thank you for having me.
Brilliant. Thank you, Tanya. And Jen, you're next.
Hello everybody, my name is Jen McNesfield. I'm currently working as a physiotherapist in Salisbury, but I'm a recent graduate. I graduated last summer, and during which time I took part in the Council of Deans for Health 150 Leaders Student Leadership Programme and completed a project in environmental sustainability and co-founded a physiotherapy specific group encouraging sustainability across our profession. So it's been an absolute privilege to be able to be one of two student voices in the development of this really, really important guidance document.
Amazing, thank you. And last but not least, Suzanne.
Hi there, I'm Suzanne Martin. I hold a professorial post in the School of Health Sciences at Ulster University in Northern Ireland, and I teach into the Pre-Reg and Post-Reg AHP courses.
Thank you, Suzanne. Right, so I'm going to come back and ask each of you a question based on kind of the different contexts that you've just described. So Liz, I'll come back to you first, if that's okay. So you're from the British Dietetic Association, as you said, the chief exec. So can you tell us a little bit about what were the enablers and barriers that you faced when you were incorporating planetary health and environmental sustainability into the BDA curricula, and particularly thinking about what advice you might give to other professional bodies who are refreshing their curricula, and also any kind of feedback that you got from HEIs.
Thanks, Linda. So the BDA had previously done some work on the One Blue Dot campaign, which I'll pop a link to in the chat in a minute. And that's what had raised the profile of sustainability as a priority area to work on for our members. So it wasn't a surprise to our members that we were starting to look at changing the curriculum in this way. We created first a robust steering group, which included representation from all 4 nations who had experience and expertise in HEIs, practice education, industry, public health learners, and all of the related matters. And this group supported the content discussions and also helped us to identify what areas might cause concern or challenge in the curriculum development. And that helped us just to be quite well prepared. Wide engagement, as everybody will know, is always part of the curriculum development process, and it's really important that stakeholders are able to be listened to and that they understand the parameters and scope of what the curriculum could and should include. So as part of the process, we gave quite a lot of time to this, extensive planning, particularly around communication, getting the messaging right, and devising questions for engagement. And getting this right was seen as absolutely critical so that we were able to address queries early on in that development process. Once the draft curriculum had been developed, it was sent out for consultation with members, and that feedback was gathered and responded to, and the curriculum amended as appropriate. Most of the feedback was really positive, and I think largely due to the groundwork, but also because this is such an important topic for our members. just the second part of your question, Linda, I don't really feel qualified to provide advice per se to my colleagues in other professional bodies, but I will tell you some of the things we learnt on the way that were important to our development of the curriculum. One of those is looking at really what the needs of the future workforce are, not just today's workforce. And we need to be, as a professional body, we need to be equipping the future workforce with the tools and resources they need to answer questions from people they're providing a service to regarding nutrition and hydration and the impact on the planet. But we also want to make them leaders in the sustainability space. And to do that, they need to have the knowledge and the evidence base to fall back on. So part of what we needed to do was desk research to make sure that we were reviewing what other curricula, how other curricula were being developed, both nationally and also internationally. And also look at what the policymakers were saying, because, you know, we know sustainability is vitally important on in the political arena at the moment, but there are also so many other priorities. So it was critical that we were saying things that were going to equip our members for the future, for how they need to be leaders in that arena too. And it's also critical for us that we consider the focus and priorities across all 4 nations. Curriculums are already packed, as we all know. So we surmised from the outset that HEIs would not be in a position to deliver complete modules on sustainability. So it was deemed to be more powerful to make sustainability a golden thread to run throughout the curriculum. And we've got a similar approach to this in the EDI space as well. So we included sustainability in a number of places, specifically as part of our education mission, in the knowledge domains and in the values and behaviours domain. We also included it in the glossary section because it's so important to define what we meant by sustainability and then use that definition consistently. The final part of your question, Linda, I don't think we did receive any pushback from HEI's re-sustainability, because it's not just one of our priorities, but HEIs are taking this very seriously as well, and it's one of their priorities. So they were really positive and welcoming of these changes. My final comment would be not to underestimate the amount of time required to review the curriculum. In addition to reading widely, look at what your organisation has already done in areas of sustainability and build on that. And also see what other AHPs have done and what we can replicate. We're all in the game of sharing and collaborating, which is the only way we're going to get through the sustainability challenges, is working together.
Absolutely. Liz, thank you for that. That's really helpful. And you talking about kind of weaving through the curricula, recognising how busy the curricula are, just leads really nicely onto my question for Jill. So you remember, colleagues, when Jill introduced herself, that she's been on this road for some time, and has kind of well-established programs around sustainable healthcare, weaving it through your modules. So, Jill, the question for you is, if you were to start this journey again, with the benefit of hindsight, would you do anything differently? And what advice would you give to other programme leads who might be at an earlier stage of this journey?
Thanks, Linda. It's fascinating to hear that Liz has been on a similar journey, but from a different perspective, really. And the whole concept of a golden thread, I think, is the absolute key one. What would I do differently? I think I found the golden thread that I could use in the programme that I was working on. But I think what I would do differently is I need some more allies alongside my colleagues to weave that through more succinctly. We spend a lot of time, I think, when we are validating our programs, having things accredited and approved, looking at the kind of competency-based standards. And I think what I'd probably look at a little bit more would be how the Sustainable Development Goals actually should be some of the standards that we need to map our curricula against. You know, you look at all of those and they all very much align with all of our AHP professional codes of conduct. So using that, I think, is really important. For me, our golden thread was around inequality, advocating for patients and patient-centered care. And for the way I was thinking about it was that we couldn't really do that unless we understood what our patients, our populations actually looked like, delving through the data on looking at history of the local areas, looking at how climate change not only is affecting them now and in the future, but also how it affected them in the past, how that impacted on the facilities and resources available to those people, how that subsequently influences health outcomes. COVID's been brilliant in some respects in giving us more data in this area, in that, you know, if you look at some of the stuff coming from the Health Foundation, you can see there are clear patterns where inequality matches where there are poor resources, facilities, accessibility. COVID hit those populations harder. So these things are already happening. And it was easy actually to get allies amongst the student population, but it's been less easy to get that amongst my colleagues. So it's been a bit of a hard sell getting it through that way, but we're starting to embed it now in more interprofessional modules, which has been great. And students are really kind of grabbing it with both hands. But the thing that I would advise the programme leads to be wary of, I suppose, is something that Jessie actually touched on earlier, is that kind of eco-anxiety. I underestimated really how accountable some of our student and the younger generation actually feel. They feel the responsibility for saving the world, but also have no idea where to start and feel completely overwhelmed with that. So it's making sure that you kind of pitch things in a way that they can feel supported, that they can use their voice. I've very much said to all of them is that when we talk about this kind of stuff, I'm not trying to turn them into the next climate activist. That's not the role that they have to be. But we do need to think about our individual responsibilities, our role modelling, our individual kind of clinical practice and how we can change that, and service improvement, but then also our professional responsibilities. And that collective voice, I think, gives them a lot of reassurance in that area, that they can see that there are people out there talking through the same areas. And then the final bit of advice is that actually there is an awful lot of evidence out there to explain why we should be using this and doing this. And I've been able to use that to create something that looks very similar actually to the framework that is there already. So it was helpful to be validated by Jessie's work actually, that it is possible and it's definitely doable.
Brilliant, Jill. Thank you for that really, really wise advice. And maybe when I come to Jen later, she might want to pick up on some of what you said about the anxiety around climate change. But really good advice there as well about the crossovers with other aspects of education, such as inequalities and the need for allies. So I'm going to move on, thank you, Jill, to Simon. So Simon, I know you're really interested in this agenda, again, as an educator, but you're kind of much earlier on your journey. So I think we were really keen to hear from you, kind of having had an early sighting of the guidance that Jessie's produced, kind of what your initial thoughts are about kind of your next steps, and if there's any further support that you think might be needed.
Yeah, thanks very much. Well, it may seem common sense or too simple at the start, but quite frankly, to think about initiating, whether it's teaching sessions or designing modules or even interweaving this topic into a whole program, it's extremely reassuring to have one document that has lots of things to pick up in terms of guidance, information, support, examples, evidence base has just been mentioned by Jill. And quite frankly, I picture myself and others, if they've got two screens, having one screen open for the document while they're thinking about the sessions that they're putting together. If we all think specifically about our individual programs or professions, we can probably come up with specific examples of clinical skills that we think should be part of a program, and maybe even things that we got taught and things that we know get covered in when students are on placement. I think this topic is so great, so massive, so big, and also I can feel potential uncertainty to pick up on what Jill said, in that individuals, depending on their personal interests and reading, may be lacking confidence in their own knowledge, let's say, and not totally sure of what topics could actually be included in the curriculum, and you know, also comparing themselves, if they are a different generation to the students, feeling that the students might know more than they do, and there's all uncertainties like that. So I can anticipate some of the things, let's say, that Jill was talking about, in regards to, let's say, getting people on board and making sure that staff feel, let's say, educated when they are simply, let's say, planning sessions and deciding how to introduce the topic. So to go back and give a clear answer, I think it ticks all those boxes for guidance, support, and a excellent kind of educational resource to guide someone who knows about, let's say, pedagogy, who knows how to deliver teaching, but it's more perhaps specific information about a very a topic, like I say, that they depending on their interests, they may feel like they don't know a lot about, I think.
Really good feedback, and I suppose as you kind of get into this, Simon, and start kind of putting it into practice, you'll hopefully have some useful feedback for us as well in terms of continuing to develop it. But I'm really kind of pleased from your perspective that this feels like it's ticking the right boxes in terms of what you need at this stage, which is great. So that moves me nicely on to Tanya. So Tanya, you've kind of been obviously engaged through your work in understanding more about learners' perspectives on this, but also kind of that maybe that link between kind of the academics learning space and the practice educator learning space. So I wonder if you would be able to give us a sense about how academics and practice educators can work collaboratively to ensure that learners can really apply what they're learning in their programs once they're out in clinical practice.
Yes, thanks. Thank you, Linda. I suppose I would like to start from just the place that we really struggled with this. We just thought this was so difficult, and we knew that there's a real challenge ahead of us, and something needed to change. And I think it comes very much, or it all came very much from the place of, almost a dummy's guide. Where do we start? Just tell us what to do, because I think so much of the information that's out there is theoretical, it's big. And that's why this particular piece of work, and everything that Jessie's been working on, is so valuable, because this is really what we need. We need real examples, practical examples, and simplification. And I think in the program that myself, my colleague Kayan Hess has been working very closely on now for a couple of years, has been really starting with the principle of a spiral curriculum. So as you say, a golden thread, and thinking about how do we take this topic and really work on this in a practical way. So the things that we I suppose have come up with in relation, we found that we're trying to explore a little bit more in relation to that link between the academic education piece and what actually happens in clinical practice. Well, first and foremost, within 3 or 4 years, any learners that you have now are the clinical practitioners. So what you're teaching them now is the habits that they're going to be bringing into clinical practice in relatively, well, in environmental terms, in a long time, but in our life terms, it doesn't feel that long. So two of the things I would briefly comment on, because I'm also mindful of time. One is around this idea that we've really tried to think about what pedagogy tells us in relation to moving from novice to expert practitioners, and novice to expert thinkers. And I think that if we can align, with an AHP education, the expectations from our students, and how we even just set up the paperwork with practice educators when they go on their first placement as compared to their final placement. Those are practical skills that we can really shift And so, no, we can't always, maybe we can't evidence the changes we make for the practice educators in their clinical practice, but maybe we can just, instill some of those ways of thinking. And then the other thing that I think we've really tried to embed, certainly within our program, which I acknowledge is just one, it's an occupational therapy program, but we've really looked at what we know about professional reasoning, and we know that all of the allied health professions have complex forms of professional reasoning. Some are profession specific, some are kind of cross-professional, but we certainly, for our novice, as we support our students from being novice to more advanced and expert learners, we ask them to articulate very explicit forms of their clinical and professional reasoning, and we've kind of proposed, myself and Kayan have kind of proposed that actually if we include two forms of clinical reasoning, environmental reasoning and sustainability reasoning, as explicit forms of clinical reasoning that we're asking our students to articulate in relation to any form of interaction with a service user, then if this is something that is then embedded within their placement paperwork, for example, that could be something that is that starts in that real, as I said, the dummies guide. What is that really simple way to create those tangible links between the university and the practice education? So, there's so much more that we could talk about, but I think those are the two key things that we found have been quite important to emphasize.
Thank you, Tanya. That's really helpful and really practical, which I think is really important, isn't it, in this? So thanks for that. I'm going to move over to you, Jen, as a kind of having recently experienced AHP pre-reg education, and congratulations on graduating. So can you tell us a little bit about your experience of being a student on placement, but also having recently qualified as a clinician, trying to apply sustainable healthcare in practice? And from your perspective, if there's anything that you think universities could do more to support learners. And you may, Jen, if you've got time, you may want to just pick up briefly on the anxiety issue, only if you feel you can. Don't worry if you can't.
Yeah, I think it's suffice to say my experience has been mixed. So as I said at the beginning, I've been practicing now for 16 months, and I've come across very good experiences where I've tried to talk about sustainability or include it in my practice. A great example is the fact I'm here. I've been involved in this project during my first year, and my team leaders allowed me to do that. So, that is great in itself, that this was seen as a way that was, legitimate for me to use my time. And another good example is I delivered a placement presentation to my team that I was on a student placement with on sustainability, and that was received really well. So that was a fab experience. I would say the bad is being told maybe that it's I don't have time for it, or not being allowed the ability to actually include it in my day-to-day work. The NHS has me for 37.5 hours, and I need to be seeing patients and writing notes. And why would I be getting involved with the ward recycling? That's not how my time should be being used. So that would be the bad. And the ugly would be blanket being told it's not relevant, which unfortunately has also been my experience. So I would say it's quite mixed across the board. But in terms of universities being able to support learners and recent graduates kind of when they come across the bad and the ugly, I think two main pieces, and I think they lead quite nicely on from what both Jill and Tanya spoke about, but that idea of the collective voice, so the consistency. I know when I was a student, the two things I wanted to know was what was I going to be assessed on, and what was going to happen when I turned up on my placement. And if this golden thread is through assessment, which I know this document is recommending it is, that's really helpful. That's a consistency and that's a legitimacy to the learners. But then that being supported and seen on placement, and I love the idea of that being on like the placement assessment forms to clinical educators. So universities supporting the clinical educators, communicating that this is a priority, this is important, so that when learners turn up in their clinical environments, they're seeing this being demonstrated and supported and being helped with that learning and how to apply it. So yeah, I think that's for the consistency, that's really important. So that's the one piece. The other piece I would say is this going hand in hand with leadership skills, because when you are the most junior, least confident, brand new voice on a team, and you suddenly start speaking about sustainability and we need to consider the environment and what we're doing, and no one's even ever thought that before, that's a really scary position to be in. And you can really lack confidence if you don't know how to go about creating change. So coming hand in hand with leadership skills, you know, SUSQI is a great example of kind of a framework to work through, and knowing how to begin even applying change, which when you are brand new and feel like you don't have a voice in what's happening anyway, I think that can be really helpful.
Jen, thank you for that. And I think that's really something for us to reflect on, isn't it? That link with leadership and kind of supporting people who are passionate about this agenda to be able to apply it in practice. Thank you for that. Colleagues, we've got one more panellist to come to, and I know we've been trying to answer a lot of the questions in the chat, so hopefully we won't run over too much. So the final panellist is Suzanne. So Suzanne is in a very unique position as having previously been the Chief AHP Officer for Northern Ireland, but also an academic. So Suzanne, you've seen the big picture, and you've been involved in delivery. So could we have your take on what would be the, in your view, the next steps to support this agenda to be embedded effectively?
All of the nations and regions of the UK and also the Republic of Ireland have adopted collective leadership as their leadership strategy. And that theme has come out quite a few times. And I hear, Jen, that sense of I really want to be involved, but I'm only new, I'm not involved. If you're working in a space where they are really embracing and embodying collective leadership, you should find that space and opportunity to have your voice heard, and hopefully you will. And within that, then co-production, I think, will be very important to enable, you know, we've got this great piece of work that has been co-produced at a strategic level within the UK. So it's now really important that we sort of galvanize all of that energy and try to operationalize what we see. So we've heard a lot about higher education, but what we need to ensure is that once people move into services, that they don't have the sort of experiences, kind of hearing a little bit from Jen, you know, we don't want people to become disillusioned. We want to harness that passion. We know, for example, that there are many AHPs who are leaving our professions because they are dissatisfied. So for some of them, this may be a really important life agenda. And it is really important to the health and the wealth of our nation. So we need to figure out how we can weave that golden thread into the curriculum, but to do more than that and make sure that that really migrates into the experience within the NHS across all of the places where we live. And I think that all of the capos, I'm sure, will have a role to play in this. I can only speak to my higher education institution, Ulster University, and they have adopted the 17 principles, the sustainable goals of the UN, and we have to evidence how we are delivering those within our teaching and our research. And I think bringing all of that together with this strategy really adds to the richness and will hopefully enable us to deliver going forward.
Brilliant, Suzanne, thank you. Sage advice there, and that commitment, I think, from the 4 capos to this is really critical. So massive thank you to all of our panelists and obviously to Jessie. I think you've taken us through a nice journey from different people's experiences. So Robin, I'll hand back to you. Thank you.
Yeah, no, thank you, everyone. It was really great to hear all your different perspectives, from professional bodies to HEIs to students who are recently qualified. We've slightly run out of time for questions. I know we've had some questions in the Q&A, which hopefully a lot of them have been answered. But if you have any more, I'm sure Linda and Jessie will be really happy to take them via email. And please do get in touch with the council, and we can also filter any questions as well. Just there was so much so much valuable stuff to hear from everyone that we've slightly run out of time. So thank you everyone for listening today. The guidance is available on the Council of Deans website, and it is posted on the chat, and you'll see it online on our website. So please do read it, use it, and share it. So thanks again to all the speakers, and especially Linda and Jessie. There's just a quick poll on the screen to see how useful you found today's webinar, but hopefully see you all again soon, and thank you for listening.